I'm Amy Mack, Program Manager for the California Opioid Safety Network at the Center for Health Leadership and Practice, a program of the Public Health Institute. You are about to watch a quick take that has been condensed from its original format to present examples of naloxone and stigma reduction campaigns. The subject matter expert for this quick take is Jenna Haywood from the Harm Reduction Coalition. Let's get started.
I work in public health, and we are working with McAven, Mendocino County AIDS and Viral and Hepatitis Services. They do a free needle exchange throughout the county. What we're trying to do is support them and have a media campaign which includes McAven so that people know where to take their needles, where they can meet for needle exchanges. They also get other services like testing for HIV and hepatitis and referral services out to the rest of the community as far as like behavioral health or treatment services if they're ready for treatment.
I pulled up a document that involved looking at different media campaigns for naloxone, but it was heavily funded. So when you look at this and you compare it to something you might do in your own community, don't be discouraged because they had a lot of money, and this was something that was done in San Francisco. But I think a couple of the key questions to think about when you're looking at doing any kind of campaign is who is the target? Who would you want this campaign to reach? People who use drugs, or who would it be for?
We want it to be for everyone because that's part of reducing the stigma and people who use needles. So we really want to reduce that stigma via the media campaign and at the same time cleaning up our streets. So we're really just trying to clean everything up. They're being just dropped everywhere, and especially in parks, in at playgrounds, in the bushes.
So it sounds like it's kind of a twofold reduce stigma, the stigma
Right.
that surrounds people who use drugs, and you also want people who use drugs to be able to know where they can properly dispose of their syringes.
Right.
On the screen right now is a document, it's a really long document called Worlds Away in a 7x7, Perspectives on Reaching Diverse Groups of People Who Use Drugs to Prevent Fentanyl-Related Overdose in San Francisco. But you could apply a lot of these principles to any kind of harm reduction intervention you're looking at. If it's reducing overdose, if it's reducing stigma, if it's providing information about where to dispose of syringes. So they did a great job here, and I spoke with my colleagues who put this together and kind of asked them, like, what were some considerations, and what they really said is one of the things that was most helpful is they did focus groups. And so focus groups, should absolutely include people who use drugs, but it could also include community leaders and community members who might want to weigh in about what would they want to get out of something like this. Actually, and there's information in here about that. They actually talked to people who use drugs. They showed them these different ad campaigns and asked them, who do you think this is talking to? And what they found is that what they thought about was not always what people who use drugs who were in their focus groups actually what they resonated with.
Right.
So these are not the ads that they came up with in San Francisco. These are examples that they used in the study to show participants. And so this is one that's out of New York, Save a Life, Carry Naloxone. So you can kind of see the differences here.
And I walked by some of them last week because I was in San Francisco. It's a shame that there's not a safe site for use because I was at UC Hastings College in the Tenderloin and people were shooting up on the street.
Mm-hmm. Yeah, that area specifically, there's definitely a lot of active drug use. There is a campaign right now here in San Francisco that we're co-sponsoring for a supervised consumption site, and that's one harm reduction intervention that folks have been trying to implement in San Francisco for several years now. The DOPE project, which is a part of Harm Reduction Coalition, their city-based naloxone program, out of this study, they did produce an ad campaign that has just been released. But these are some examples from New York where it's real-life examples of people saying, I saved so-and-so's life and their story. So folks from the community, and then it has contact information, what is naloxone and how can you get it in your community. Here's a child who saved his father's life, saved my neighbor's life. One about fentanyl. This one's a little bit more fear-based, going for kind of a shock value. You've got your spoon and your syringe. What is the risk of, say, just providers sitting down and coming up with an ad campaign that they're hoping will encourage people who use drugs to properly dispose of their syringes? You know, if we're not asking questions to people who are the targets of a campaign, how do we know that these messages are going to reach them? So those are some examples.